Some of the metrics that organizations want to begin to look at is really where patients are moving through the system. How many of those patients are using what we call the domestic network, or the network of the clinically integrated network, versus how many of those patients are leaking out of the network. You also want to begin to look at the cost of care. So, for instance, how much is the per member per month rate of patients or the members who are utilizing the clinically integrated network? It would also be helpful for organizations to think about breaking down that cost by certain clinical conditions, if you will. So diabetes, coronary artery disease, those things that are driving value. And then lastly, from a hospital perspective, you want to look at some of the other big drivers like the readmission rates and how the clinically integrated network is starting to manage and support management of that readmission rate, transitions of care rates, and are patients staying within the network and so forth. If they're able to utilize all of those indicators together, they're going to really begin to get their arms around the clinically integrated network and really the outcomes that are necessary in being able to manage patients all the way through that continuum.